Hi, my name is Savannah Malky, and I did my public health presentation on the West Nile virus. What is the West Nile virus? The West Nile virus is an illness caused by a mosquito-borne virus of the genus Flavivirus, which means that it is most commonly transmitted to humans by mosquitoes. The West Nile virus is caused by a bite from an infected mosquito and causes encephalitis and flu-like symptoms. Who is at risk? People living in an area where West Nile virus is present in mosquitoes. West Nile virus has occurred every summer since 1999. It is highest for people who participate in outdoor activities because of the exposure to mosquitoes. These mosquitoes are usually infected and spread the virus to humans and other animals. In rare cases, it is spread through blood transfusion, organ transplants, or from mother to baby during pregnancy, delivery, or breastfeeding. What are the symptoms of West Nile virus? 70 to 80% of infected people do not have symptoms. 1 in 5 people infected develop fever along with other symptoms. Less than 1% of people infected develop serious, fatal neurological illness. Some examples of neurological illnesses include headaches, high fevers, neck stiffness, disorientation, coma, tremors, seizures, or paralysis. The recovery period is usually several weeks or months if they show symptoms. 10% who develop neurologic infection may be permanently ill and may die due to the West Nile virus. Where does West Nile virus occur? It has been detected in all 48 states except for Hawaii and Alaska. Outbreaks are in local areas and seasonal outbreaks vary, normally from June to September. Some influencing factors include the number of birds that have the virus, the number of mosquitoes that spread the virus, and human behavior. West Nile virus has also occurred in Europe, Middle East, Africa, India, Asia, and Australia. It was first detected in 1999 in North America. And has spread across the United States and Canada. What is the diagnosis for West Nile virus? Based on clinical signs and symptoms, special laboratory tests of blood or spinal fluid. Diagnosis generally accomplished by testing serum or cerebral spinal fluid to detect the IgM antibodies. Tests detect antibodies that immune systems make against viral infection. IgM antibodies are usually detectable 3 to 8 days after the onset of illness and persist for 30 to 90 days. Is there a cure to West Nile virus? Unfortunately, there is no cure to this virus, and there is no medications to treat or vaccines to prevent this infection. There is only over-the-counter pain relievers to reduce symptoms. Some people with less severe symptoms recover on their own. In severe cases, people receive supportive treatment at the hospital. Some public health intervention programs include the Integrated Vector Management, which monitors mosquito abundance and infection rates. Its objective is to implement control measures sufficient to maintain mosquito abundance below levels that result in high risk of West Nile virus transmission to humans. Another public health intervention program includes the Environmental Health Branch, which coordinates and monitors the city's preparation and response to West Nile virus, and it investigates all reports of mosquito activity. All countries and cultures reduce risk of West Nile virus in quite similar ways. It is controlled in many areas through the use of habitat modification and pesticides. In order to reduce risk of West Nile virus, we must utilize insect repellent, wear protective clothing to prevent mosquito bites, install screens on doors and windows, empty standing water from containers to reduce number of mosquitoes around your home, and stay indoors, specifically in air-conditioned rooms. And to summarize all these ways of reducing risk, we can see them as the 3 Ds for personal protection, which include drain, defend, dusk, and dawn. Some recommendations for healthcare providers and people at risk is to obtain appropriate specimens for lab testings, promptly report cases to state or local health departments to allow for appropriate control measures, and consider West Nile virus in the differential diagnosis of patients with aseptic, meningitis, or encephalitis. Diagnosis is still very important in order to stop unnecessary therapies, predict patient outcomes, and direct public health prevention measures. Thank you so much for your time and attention.